The plan of getting more, for one, is a good thing for the vaccines to be gotten. But I would have, personally, advised that we should do more testing. Because as it stands today, Nigeria have only tested less than 2 million people in a population of over 200 million. I think our attention should have been directed first and foremost towards testing more people. Let's have a statistics of the number of persons that actually have COVID-19 infection. By then, we should be able to now say, okay, with this plan, this is the infection rate, and this is how people will get infected with the virus, and we're able to plan with that. Because if less than 2 million have been infected based on the statistics made available to the public, and we are getting like 4 million doses of vaccine, is it that those that have been infected are going to be taking it? So I think we should have to do this thing systematically, not just dabbing into getting vaccines and all of that. But getting the vaccine is a good one. And then the issue of those to be vaccinated, well, the government has rolled out our healthcare workers, government functionaries, and all of those stuff. But this also there's a problem with this. The problem is in the sense that if you say frontline workers, the healthcare workers, the government functionaries, and all of those stuff, with 4 million doses, and each person is supposed to take 2 doses of this vaccine, which we are looking at about only 2 million people taking this vaccine. And with these 2 million, do we really have the statistics of the people who actually would take these vaccines? Now, other clients, they pay priority to they prioritize the frontline workers, the veterans or the elderly, the journalists, those that actually are really, really exposed. But I don't think we have those statistics. And now, as it stated, it has started in Abuja and other states and all of those stuff. But now, I don't understand the plan which they use to vaccinate everybody, because even the frontline workers, there are different categories. There are those who are working in the isolation centers, and there are those who are working in the different hospitals, and even those that are not in public health. So how this is going to be done, I really don't know. But I believe that, yes, give priority to frontline workers. Then the government of functionaries, because they also engage in day-to-day business. So with that, but all of this is actually based on statistics. If you don't have statistics, they're going to be garbage in, garbage out. And there are a whole lot of people who might also take the vaccine and leave Abuja and go elsewhere and perhaps want to take the vaccine again, because we have this propensity to abuse anything given to them, especially when you are not paying for it.
You could very well have chosen to do this privately and quietly, but agreeing to this publicized application will first of all boost the morale of the health sector and give a lot of assurance to the public about the safety and efficacy of this vaccine, about which we have had some concerns with regard to the Nigerian public.
We go to the social media, is awash with all kind of information in support of the vaccine and those. One thing I keep telling Nigerians is that for some who say that they want to kill Africans and all of that, all the vaccines we have been taking, immunization we have been taking from childhood, if they wanted to kill us, they would have killed us before now. That is one. And if they want to even kill us, majority of what we consume are imported. So why can't they poison that and send it back to us? So I think the issue here is that the people does not trust their leaders. So when that issue of trust is not there, no matter what you do, even if the president, they open the VAT, people are also saying, well, that is what I heard, that it was even, well, let me not even dabble into that anyway. But people still do not believe, despite the fact that the president and the vice president of this country took this vaccine on the live TV. People still are not convinced about that. So I think the issue of trust. When people trust the leaders, of course, no matter what the leaders do, even this is just small, they believe that that is the right thing. But when the trust is not there, no matter how gargantuan, whatever thing they are doing, the people still do not believe. So I think it should build on the area of trust. And they should do more sensitization and enlightenment. And also this issue of all this information that are against the vaccine. The truth of the matter is that any medicine, any drug, or any vaccines or whatever has side effects. That is true. There are some people who, even the immunization that they take, some people react to it. Everybody have their own different chemical composition. And people have there are some people who react to even as small as little paracetamol. Some people can react to it. So the fact that nobody can tell you, no scientist, no medical personnel, no doctor will tell you that that vaccine is of no side effect. Every drug or medicament have their own side effect. In order for us to now know that, okay, this side effect is minimal or is not. So, but that can only be done if it has been administered on people. So then you can also collect information and say, okay, so and so number of persons reacted to this vaccine, and so maybe they have to be, this group have to be exempted from this vaccine. They have to look for another way out where they can be vaccinated. Thank you.
I have received my first jab, and I wish to commend it to all eligible Nigerians to do same so that we can be protected from the virus. I urge all state governments, traditional and religious leaders to take the lead in the mobilization effort within their environment and spheres of influence.